Welcome to Elevation Recovery. My name's Matt Finch, and today we've got a very exciting article from Medscape. April 29th, 2021. So this was just a couple of days ago. The title is An Effective Alternative to Opioids for Acute Pain? It says, intranasal IN ketamine may be a safe and effective alternative to intravenous opioids for acute pain in adult patients, new research suggests. In a systematic literature review of 15 studies that included 2,218 adult patients, IN ketamine was associated with improved pain scores. While covering the acute pain service, myself and my co-author noticed how effective intravenous ketamine was in treating acute post-operative pain, even in adult patients with chronic pain who were not opioid naive. We knew ketamine has multiple routes of administration and wanted to identify whether intranasal ketamine could prove to be a safe and effective alternative to opioids. We did a basic literature search and found that IN ketamine has been used to treat acute pain in multiple settings and patient populations, and we wanted to do a more extensive review, she added. These findings were presented at the Virtual American Academy of Pain Medicine AAPM 2021 annual meeting. Using as keywords ketamine and acute pain, the researchers conducted a literature search of 3 popular medical databases for studies published through June 2020. Intravenous ketamine was used in the following settings: paramedic administration, emergency department, wound dressing changes, post-dental surgery, and post-spinal surgery. In all studies reviewed, pain scores significantly improved with the use of intranasal ketamine. 5 studies compared intranasal ketamine to intravenous opioids. None showed intranasal ketamine to be significantly more effective, but 75% demonstrated similar efficacy. We look forward to seeing prospective randomized control trials comparing intranasal ketamine to opioids in the post-op and post-discharge period, she said. If such research indicates that intranasal ketamine effectively reduces pain, there would be reason to explore it as an adjunct or substitute for opioids to manage pain post-discharge, she added. In the context of an ongoing opioid epidemic, it is important to identify strategies to mitigate the harm that opioids can cause. By targeting the post-operative period, when many people are exposed to opioids for the first time, there is potential to limit the number of patients who become opioid dependent, she said. Now we're on the Spravato website, which is a brand name for esketamine nasal spray. Spravato esketamine C3 nasal spray is indicated in conjunction with an oral antidepressant for the treatment of treatment-resistant depression in adults, depressive symptoms in adults with major depressive disorder, with acute suicidal ideation or behavior. Unfortunately, it also does say Spravato is not approved as an anesthetic agent. The safety and effectiveness of Spravato as an anesthetic agent have not been established. Did you also know you could get ketamine infusions as a way to get ketamine into your system? One of my colleagues, Dr. Ken Starr, who is the founder of Ken Starr MD Wellness Group in Arroyo Grande, he actually does ketamine infusions at his clinic for things like pain, treatment-resistant depression, fibromyalgia, and more. Dr. Starr's been infusing people with ketamine for more than 20 years to relieve their pain, and he really knows how to do it well. Also, about 18 months ago, I had a female client that was about 50 years old who had back pain and neck pain. I helped her to get off of around 120 milligrams daily of oxycodone, and she was actually able to get her doctor to prescribe her Spravato, the intranasal ketamine, for both pain and depression, and she absolutely loves the stuff. And this video is for informational use only. It's not medical advice. And please subscribe if you haven't already done so, and give this video a thumbs up if you got value from it. Thanks, and I'll see you next time.